In this session, I will discuss about pharmacology of local anesthetics. Here I am going to highlight the topic like definition, pharmacological classification of local anesthetics, mechanism of action, pharmacological action, pharmacokinetic, clinical uses, adverse effect, and contraindication of local anesthetics. Then from here you have to know local anesthetic, like definition of local anesthetic, and why this local anesthetic is used. There is two types of anesthetics. One is local anesthetics, another one is general anesthetics. Local anesthetics is used for local surgery or local operation or particular sites. These local anesthetics, in definition you can say local anesthetics are drugs that block conduction of electrical impulses in excitable tissues. The tissues may include nerve cells and myocytes, and main result is analgesia and anesthesia. Analgesia means pain killing. Anesthesia occurs due to the blockage of electrical impulse. Neurotransmitter, and main function of neurotransmitter is transmit impulses, and neurotransmitter converts mechanical impulses into electrical impulses. So local anesthetics blocks the generation of electrical impulses, and it blocks pain. Some difference between local anesthetics and general anesthetics based on site of action, where the local and general anesthetics will act. General anesthetics act on CNS and local anesthetics act on peripheral nerves. Area, the general effects of general anesthetics will be in whole body, but local anesthetics effect will be in restricted areas or particular area. Consciousness, in local general anesthetics, patient will lose conscious, and local anesthetics unaltered. There will be no effect on conscious in case of local anesthetics. And general anesthetics mainly used for major surgeries, and local anesthetic is used for minor surgery. General anesthetics, if patient condition is poor or poor health patient, uses of general anesthetics may be risky, but local anesthetics will be safe. For uses of general anesthetics, essential care should be taken, but in case of local anesthetics, no need for care. Pharmacological classification of local anesthetics. Local anesthetics contain two groups, amide group and ester group. Amide group containing local anesthetics are lidocaine, bupivacaine, prilocaine, dibucaine, mepivacaine. And ester containing local anesthetics is benzoic acid, benzocaine, cocaine, tetracaine, and para-amino benzoic acid. And based on mode of application, local anesthetics may be divided into two. One type may be injectable, another is surface anesthetics. Injectable local anesthetics can be classified into three based on potency and low potency, short duration like procaine. Some drugs have intermediate potency and intermediate duration like lidocaine, and high potency, long duration is tetracaine, bupivacaine, ropivacaine, and dibucaine. And surface anesthetics can be classified into two. One is soluble, another is insoluble. Example of soluble anesthetics, that is cocaine, lidocaine, tetracaine, and insoluble benzocaine. Here one chart is there based on duration of action. Local anesthetics can be divided into four. Ultra short, example is procaine. Short, example is lidocaine. Medium, example is mepivacaine. And long, example is bupivacaine. This chart is very important for MCQ question. Then some characteristics, ideal characteristics should be there with local anesthetics. Local anesthetics should be reversible, should have reversible action, should be non-irritant. Local anesthetic should not have any allergic reactions and should not have any systemic toxicity. It should have rapid onset of action. It should have sufficient duration of action. Local anesthetic should be potent, stable in solutions, should not interfere with healing of tissues, and it should be less expensive. Here mechanism of action of local anesthetics. Main mechanism of action of local anesthetics will be blockage of sodium channel. Here you can say local anesthetic receptor is there, and there when it is the membrane, axonal membrane, 3 phases is there: in resting phase, activated phase, and inactivated phase. In resting phase, receptors will be this, and when local anesthetics will binds with this local anesthetic receptor, then this receptor sodium ion channel will be activated, and this activated will leads to stabilize the channel, and this channel will be in inactive stage and thus reduce the probability of channel opening. Then the local anesthetic block nerve conduction by decreasing the entry of sodium ion. You can understand it is the sodium ion channel, and selective, it is here selective pore is there. This entry of sodium ions is there. In open state, that means in open state the local anesthetic will be binds with the receptor, and when binding there will be closing of these 2 receptors. That means it will closed, sodium ion channel will be closed. Then inactivate the channel. After inactivation there will be no nerve conduction or electrical impulse. Then some techniques, or you can say uses of local anesthetics or techniques of administration. There is some techniques is there how local anesthetics can be administered. Topical anesthesia is given, infiltration, conduction block, some field block and nerve block is there, peridural block is there, spinal anesthesia. There are some. Here one chart is there based on duration of action. Local anesthetics can be divided into 4. Ultra short, example is Procaine. Short, example is Lidocaine. Medium, example is Mepivacaine. And long, example is Bupivacaine. This chart is very important for MCQ question. In topical or surface anesthesia, some uses is there, or in case of oral surgeries, nasal intubation or superficial surgical procedure, this anesthesia is used. Some advantages associated with this, and technically easy, minimal equipment, and disadvantage also there, potential for large dose leading to toxicity. Topical or surface anesthesia, large dose is required for surface anesthesia, and this large dose may lead to toxicity. Then local infiltration or field anesthesia is there, and you have to know the uses of these. Main uses is suturing, minor superficial surgery, line placement, more extensive surgery with sedation uses. And some advantages there, like minimal equipment is required, technically easy and rapid onset of action. And disadvantage is associated with it. It is a potential for toxicity if large field. Then conduction block. Next uses is conduction block. Here local anesthesia is injected around nerve trunks so that the area distal to injection is anesthetized and paralyzed. Conduction block, here two block is there. One is field block, another is nerve block. In case of field block, is done for appendectomy, dental procedures, scalp stitching, operation in forearm and legs. Nerve block is used for tooth extraction, operation in eye, limbs, abdominal wall, fracture setting. These two block is there. Epidural anesthesia. In epidural anesthesia, local anesthetics is injecting into peridural space, a covering of the spinal cord. Example is lidocaine, bupivacaine. And based on mode of application, local anesthetics may be divided into two. One type may be injectable, another is surface anesthetics. Injectable local anesthetics can be classified into three based on potency and low potency, short duration, like procaine. Some drugs have intermediate potency and intermediate duration, like lidocaine, and high potency. After that, you have to know pharmacokinetics. In pharmacokinetics, pharmacokinetics include 4 ADME: absorption, distribution, metabolism, and excretion. Here, pharmacokinetics, soluble surface anesthetics, some like lidocaine, tetracaine, these are the soluble surface anesthetics, and these are rapidly absorbed from mucous membrane and absorbed areas. After that, the absorbed local anesthetics, the absorbed, those anesthetics is absorbed into circulation. That anesthetic should be lipophilic, or it is lipophilic, that's why it is absorbed, and is widely distributed in brain, heart, liver, and kidneys. And mainly local anesthetics is degraded or metabolized in liver by dealkylation and hydrolysis. In liver, microsomal enzyme is there. With the help of that microsomal enzyme, local anesthetics are degraded. And then some pharmacological activity of local anesthetics is there, like in CNS. All local anesthetics can produce CNS stimulation followed by depression. Example is cocaine. And in CVS, cardiac depression at IV doses. When local anesthetics is injected, then cardiac depression is there. And procainamide this procainamide have anti-arrhythmic action. For the treatment of arrhythmia, procainamide is used. Some side effect is associated with this local anesthetics, like allergic effect is there, CNS toxicity, and CVS toxicity, like hypotension, arrhythmia, myocardial depression. Contraindication of local anesthetics. In some condition, this local anesthetic should not be taken, like in case of heart disease, hyperthyroidism, diabetes, allergy. If any patient has allergy to local anesthetics, that patient should not take local anesthetics. Infants and child, mentally retarded patients should not take local anesthetics. Some MCQs question is there. You can solve this and in exam. After that, you have to know pharmacokinetics. In pharmacokinetics, pharmacokinetics include 4. I have discussed around 11 MCQs and lots of MCQs is there. You can search in Google. You will get all types of MCQs. Thank you.